It is a process that started 5 years ago or 4.5 years ago when I came to Mount Sinai and Dr. Tawari hired me to start the Robotic Cystectomy Program. That was like the idea of me coming here. We started even before I came to plan that how we should build this program. Because at the time, this department did maybe 50 cystectomies a year, and now we do 120 or so. So it's been a growth. And when you grow a program, it's not only the surgery, it's not only that there's more time in the OR, but there's a lot of work to be done in the department. So, because these are the most complex patients that we have in urology. So they will be relatively heavy before surgery because you have to do a lot of things, a lot of scanning and optimizing before surgery. And then the post-operative period is also much more complex than, for instance, prostatectomy, partial nephrectomy, things that patients go home almost all of them the first day after surgery. So these have a lot of other comorbidities. So you need to have a big program for this, not only the actual procedure, but also how you take care of the rehabilitation of patients after. So the physiotherapy and rehab afterwards and follow up afterwards. So this was a lot of working to get all of these pieces into place. But now I think it's running very smoothly.
So I do think that we're one of the few institutions in the country that really focus on doing this procedure minimally invasive and completely intracorporeal. And now with our 500th case being performed, we have, pretty sure, the largest experience in this country and have learned a lot through the years with this procedure. So the first step that we took was really to perform this procedure without narcotics. So 90% of our patients will not use a single use of any narcotic, any opioid, while they're in the hospital or during their recovery, which I think is a huge accomplishment. And that couldn't have happened without the help of our anesthesiologists who have helped us perform nerve blocks and so forth. I think secondarily, we've been able to decrease the risk and rates of ileus without actually increasing the expenses or giving other medications because of the ability not to use opioids, not to use any narcotics. So that's been a huge accomplishment. Those two things I think have drastically helped our patients. The next step has been really to work with our infectious disease experts. So we have tailored our antibiotic, maybe going against a little bit of what guidelines are saying, and have made what's called an antibiogram specific antibiotic regimen, which has alone now decreased our infection rates to about 10%. Which is really low compared to the sort of general population of patients who undergo this type of procedure. We've also teamed up with our geriatrics team to really help with our elderly, maybe a little bit more frail patients. And that does two things. It helps us select our patients better who should undergo surgery or who should maybe get other treatments, but also has helped us. They see the patients before, help optimize the patients, help us after the procedure with all the other medical comorbidities that these patients have. The last two things has been really our medical oncology colleagues. We've been working very closely together, Dr. Galsky here, who we have this really cohesive multidisciplinary approach to help identify if systemic therapy is the better option first or later, surgery first, etc. And that has really allowed us to help with how we should treat our patients. And lastly, I think it's all our researchers. We have a huge translational program here. We focus on both muscle invasive and non-muscle invasive bladder cancer. And that alone has helped us identify novel treatments. And actually we just got awarded a very large grant to perform a clinical trial on a combination of immunotherapies that was discovered here at Mount Sinai with our team. That will be starting hopefully by the end of the year. So I think we've done a lot over the last 5 to 10 years to really help minimize complications, improve our patient outcomes from surgery, but even more improve the science and the learning from the bladder cancer in our patients to hopefully make the future brighter for them.
When you look at the bladder cancer outcome, a few variables that play a very important role here. One is the patient's presentation, the stage that patient presents with. Then there are variables such as hospital experience and surgeon experience. So when you talk about 500 robotic radical cystectomy intracorporeal diversion, what it really, I think, signifies that as a department, we have done a lot of these, and certainly when we look at our outcome in terms of readmission to the hospital, we are definitely below the average, national average reported. And I think we can just owe this to our experience and our continuous adherence to the protocols and the pathways that we have had for the last 500 cases.
So I think it's really important to highlight what Dr. Wicklund has sort of built here as a bladder cancer team. Almost every other major medical center, academic institution has stalwarts who do surgery. We happen to be a powerhouse of talent when it comes to bladder cancer. But when a patient or, a colleague refers someone to us, what we truly are able to offer them is, between Dr. Wicklund, Dr. Spakianos, and Dr. Morazin, the three pillars of our bladder cancer team, more than half a century of expertise, of a powerhouse in research talent, and just of sheer volume that no one else can. Half a century is a lot of time spent thinking about patients, refining a procedure, doing it well, and then doing it over and over and over again so you have the best possible outcomes. This is a tenacity and obsession with the pursuit of excellence that we are able to offer our patients. It is an honor to be part of this amazing team.
Because we know the natural outcomes basically, yes, so we can say that we have much less mortality, we have very good outcomes here, we have less readmissions and so on. So we know because we compare, we're also doing research and we are combining data with other centers. So we have the good outcomes. We have the busiest program for robotic cystectomy with intracorporeal diversion in US right now. And this is one of the busiest programs in the whole world, if not the busiest. So it's like really one of the top programs if you think about the number of procedures we're doing and looking at the outcomes. And we publish these outcomes in scientific journals, which is not, it's not just talk, but it's actually followed in a very sort of stringent way.
So radical cystectomy is an operation that is offered to patients with recurrent bladder cancer or high-grade bladder cancer. Sometimes the patients are left with this option and there's no other option for them. Be able to offer this complicated surgery robotically allows them to perhaps have a quicker recovery from randomized trials. From many studies, we know that there's less blood loss, there's less pain, less use of narcotics, which translates to getting back to a baseline, be able to eat a day or two sooner than if you do it perhaps open. Recent randomized data have shown that there's a less readmission to the hospital for patients to undergo robotic surgery. All of this is without compromising any oncological outcome, which is again very important for these patients. Be able to do what you do historically open, now doing it in the least invasive way, and given the benefit of minimally invasive surgery, I think is very important.
For anybody doing 500 cystectomies, it's a huge milestone. To do 500 cystectomies intracorporeal, I think, is even a bigger milestone. There's a lot of hurdles, and there have been a lot of hurdles to go over because of the concerns of the procedure. I think we've done a really good job to do it safely. We've done a good job to do it together as a team. We've done a really good job of being able to critique ourselves, to be able to collect our data, to review our data, and make sure that we're doing what's right for the patients. And I think that's the team approach that we've been able to sort of put together. That's extremely important, and it's been a huge milestone for us. And hopefully in the next 5 years, we can reach 1,000. But I think that it's been a really fun ride to work with the team.